Hi everyone, this is Jen Anderson from Anderson Physical Therapy and Wellness, and I wanted to go over a special topic with you today. So our pelvic floor muscles can get tight and can get trigger points in them. Trigger points are like knots in your muscles. If you've ever been massaging your shoulders and hit that one spot and it kind of radiates all the way up into your head, that's what we call a trigger point, knots in the muscles. So you can get those kinds of knots in your pelvic floor muscles as well. And that can decrease circulation in those muscles and can cause pain. So what I want to go over with you today is that we can actually massage our pelvic floor muscles because these muscles can be challenging to stretch. And so one way to help them relax is to massage them. So to give you an idea, here we've got our pelvic floor model, okay? Here is my pubic bone in the front. Here are my hip bones on the sides, and then I'm gonna turn around and we find our tailbone in the back. Now let's look at it from the bottom. Okay, so orient you again. Here's my pubic bone up top, my tailbone in the back, and then I've got my two sitting bones. This is where my pelvic floor lies. It's a sling underneath me, holding up my bowel, bladder, and rectum. If you've just gone through a really difficult labor, or maybe you just hold stress in this area, these muscles can get tight, and we're gonna wanna try to massage them and relax them. So let's think of our pelvic floor here like a clock. So up by my pubic bone, we're gonna call that 12 o'clock. Down by my tailbone, that's 6. My right hip bone is going to be 9, and my left hip bone is going to be 3. We can use our finger to help do this, or we have massage tools that we can use. Pelvic wands are what we usually use. And I have examples for you here. I don't want to take these out of the bag, but hopefully you can kind of get an idea of what they look like. So this is a vaginal pelvic wand. It's got a little bit wider diameter. If that's intimidating to you, you could always get a smaller wand. And this is a rectal pelvic wand. Now, just because it's rectal doesn't mean you only can use it rectally. If you feel like you have a hard time inserting things into the vagina because the muscles are so tight, you could use a wand that has a smaller diameter than our vaginal wand here. Now, what might be the advantage of using a vaginal wand? It is a little bit thicker, so you might be able to kind of cover more surface area in one swoop. But you always want to use the tapered end of the wand when you're doing the massage work. And the reason they're curved like this is so that when you're using them inside the pelvic bowl, that you can kind of swoop inside and hit all of those angles. So that's why they're curved like that. But again, you can use your finger. So as far as using your finger, we can kind of use our knuckles as guides for depth. So first knuckle is going to be, if I'm inside the vagina and I'm just working up to my first knuckle depth, that's pretty superficial, but can still be very effective. Second knuckle is you're going a little bit deeper, and then third knuckle depth, that's going to get you to a little bit more of those deeper structures. So when we are working in the pelvic bowl, 2 spots you want to really avoid is 12 o'clock, because right behind here sits my urethra. And then you really want to avoid working right at 6 o'clock, because that's where your rectum sits. If you go to those spots, it's going to really make you feel like you need to pee. And if you hit 6 o'clock, it's going to make you really feel like you're going to have a bowel movement. Again, so you would just move off those spots. So avoiding right at 12 and right at 6. But I will have women work more towards, so if we use our hip bones as kind of guidelines, right? So I said that my right hip bone here, inside my right hip bone, so here's my hip bone on the outside. Then I'm gonna go whoop, so we can come inside. Right here, that's gonna be 9 o'clock. And then here on my left side, here's my 3 o'clock. So what I have here, to try to kind of give you an idea, since my finger will not fit inside my pelvic model, I'm going to use this wire to kind of show you. So here, imagine that this is your finger coming inside the pelvic bowl. So right here, I'm right by the pubic bone, or right towards the back of the pubic bone. So I'm at about, let's say, here's 6 o'clock. I'm coming off this way, there's 7. And then I can work my way around, there's 8. And then I can come inside that hip bone, there's 9 o'clock. And then I can start working around towards the front. I can get my wire to turn here, there you go. So then there's 10, and then 11, and then again, you'd want to avoid that 12 o'clock spot, right? Because your urethra's right there, and then we can continue around. So 1 o'clock, 2 o'clock, here I'm inside that right hip bone, there's 3, and then I can start to work back 4, 5, and then I'd hit my tailbone again, there's 6. So you can work inside the pelvic bowl. And so what I'll tell people to do is start at 1 o'clock, that first knuckle, start at like 3 o'clock on the right side, and then work your way down to 5. Avoid 6 o'clock, and then you can work from 7 o'clock to 9 o'clock up the other side of the pelvic bowl. And I have had some women, especially with interstitial cystitis, that benefit a lot from working more towards the sides here, between 9 o'clock and 11 o'clock, and then between 1 o'clock and 3 o'clock. But you're gonna get more of like the meat of the pelvic floor if you're working between 3 o'clock and 5 o'clock, and then between 7 o'clock and 9 o'clock. So try those things. Use a lubricant. Make sure your nails are short. Make sure your hands are clean. You can lay on your back in bed and prop your legs up with pillows to try this technique. Or if you just feel like that it's hard to find privacy or time, you could try doing it sitting on the toilet. Or for some of my ladies, they'll just do this as part of their morning shower. And that's a good way for them to keep tabs on their pelvic floor muscles, and if they're tight or feeling good. When you find a tight spot, you can just hold pressure on it. So I might find just like a tight spot here, and I can just hold my pressure on it and just breathe and wait for it to soften and wait for that tenderness to dissipate. You can also do sweeps back and forth along the muscle fiber, and then you can do sweeps back and forth across the muscle fiber. So try all those different techniques. I think this is an important thing for people to explore. If using your finger kind of grosses you out a little bit, the wands might be helpful for that. If you have any questions, please reach out to me. And thanks for your time today, guys. Have a great day.